Hello. Now today I'm going to talk about the stretch marks. You know, now the stretch marks usually happens when the skin stretches. You know, our skin contains the collagens and what we call the elastic tissues. This makes our skin to stretch. Now, the stretch marks usually occur or just usually occur during pregnancy. There's a lot of physiological changes during pregnancy. The other thing is when you misuse or you overuse these corticosteroids, that can lead to Cushing syndrome. The other thing is genetic factors. If you contain what we call the fibronectin, that is in the family genetics, you can also have these stretch marks. The other thing is what we call when you gain weight and you lose weight, you are more likely to have these stretch marks. You know, now these stretch marks usually affect the female more than the male, and the areas that they affect, such as the abdomen, the thigh, the back, the axillary, the breast. This is where most of the time this one can have stretch marks. Now, the stretch marks are very difficult to treat again, you know. But again, there are a lot of treatment options, you know. One can opt to go for the over-the-counter medication, such as the retinoid creams, the vitamin A, and what we call the tretinoin creams to reconstruct these collagens. Now, the other thing is one can also opt to go for the light and laser therapy, for reconstructions of these collagens and the elastic tissues. But again, a lot of these treatments, they may not help you to treat these stretch marks completely. They may not fade completely, after even using the treatments, you know. One can also opt to go for the coconut oil, the almond oil. These have been used, but again, there is no such a complete treatment of these stretch marks, you know. So therefore, all these sometimes they are advertised the creams. They may not help completely for you to get away from these stretch marks. Sometimes the stretch marks can fade on their own, but not completely. They can't disappear completely. So therefore, when you go for these treatments, it's better to know that you may not get away from these stretch marks, but you will just make them not to appear, as before, you know. So this is something good to understand. That there's sometimes they can't go completely, even if using this advertised cream, using this what called the retinoid creams, using this laser and light therapy, the silicone gels, they only just make you to appear they just appear in a fade way, but not completely, you know. So this is about the stretch marks. You can opt to go for any treatment, you can use any medication, but they cannot go completely. Those treatments have been showing some improvement on the skin, collagen, and what we call the elastic tissue of formation, or rather the reconstruction. Now, thank you. This is all about the stretch marks. Thank you.